Watch this.
On the day Idaho declared all of its hospitals were now operating under crisis standards of care, that was yesterday, there were more than 720 COVID patients in our hospitals, nearly 190 in our ICUs, and the state reported 40 deaths. We are now in our second day living under these crisis standards. Fair to argue we're at our worst point in this pandemic, well, since it began back in March of 2020. We've learned a lot about crisis standards yesterday, but we wanted to circle back a little bit to some important points that Idaho medical leaders raised during this informational meeting yesterday afternoon. Misinformation and the morbid conditions healthcare workers are facing. Joe Paris spoke with Dr. Jim Souza, Chief Physician Executive for the St. Luke's Health System.
With the implementation of crisis standards of care comes the understanding that health services are changing. Dr. Jim Souza, Chief Physician Executive for St. Luke's Health System, says crisis standards are a spectrum we've just entered, and so far, resources are not being taken away from patients, but instead, standards have been lowered across the board.
If we have to continue doing that, we will find ourselves at a point where we're forced to make decisions to take resources from one in order to give to another for a better chance of survival. None of us are doing well with that. It often brings healthcare professionals to tears to talk about that.
During the Crisis Standards of Care news conference Thursday, Idaho medical leaders agreed that misinformation about COVID has powered the crisis we find ourselves in. Dr. Souza says his frustration is centered on those spreading misinformation to people who then end up very sick. The challenge is competing with the reality seen through rose-colored lenses.
They're putting their faith in them when they're feeling well. And the reason for that is because it feeds their confirmation bias. They're selling a really attractive message. And the message is something like this: everything's going to be okay. There's nothing bad going on. Look here, not there. Trust me. Take this and nothing bad will happen to you. You don't need to do anything differently. Just keep as you are and we'll be fine. And, it's a harder message to say we'll be fine and we have to do a few things differently. We need to, when we have a surge this big in the community, maybe not be in as big a group. Maybe wear a mask. And definitely, we need to talk about getting vaccinated.
The consequences of the situation are already morbid and tragic. St. Luke says that now they have to extend their morgue space because of the COVID death toll. That extra space will help relieve some issues, but it doesn't change what frontline healthcare workers have watched in recent days and weeks.
For a while, and this is why we're making this increased capacity, right? I mean, we had patients who expired from COVID who we couldn't move out of the room because we didn't have a place to put the body. And then we had a patient in the emergency department who needed their room, who we couldn't put up in the room because we couldn't move the body out of the room. I mean, it just all backs up. Not only do we not have enough space to put our dead, but once we do put deceased people's bodies in our morgues, the funeral homes aren't able to handle retrieving those bodies timely enough because they're backed up.
All of this has taken an indescribable toll on frontline healthcare workers across Idaho. For nearly 18 months, they've worked day in and day out dealing with very sick COVID patients, trying to keep as many people alive as possible. Leaders across Idaho continue to remind us the healthcare community needs our support. Dr. Souza says to all healthcare workers, you are valued, you are crucial.
I see you, I hear you. I admire you. I acknowledge this is a preventable tragedy, and we're called to serve. And thank you so much for answering the call. That's my message to healthcare workers.
And misinformation, Brian, is a huge problem right now. And from day to day, the misinformation conversation evolves. Today, for example, there's a rumor going around that the state of Idaho, under crisis standards of care, has a rule that you cannot resuscitate patients, meaning if you flatline and you need intubation, They're not going to try to DNR you.
It's right here in this plan, right?
That's right. So it is in the crisis of care plan, meaning it's part of the plan, but we're not at that point yet. So the rumors going around that everyone has a DNR when they walk into the hospital, that's just not true. Dr. Souza, I think, can explain it best.
Each individual facility is expected to create its own implementation plan. And to my knowledge, no healthcare facilities in the state endorsed that. And that certainly includes St. Luke's, and I know I can speak for St. Alphonsus as well. We are not implementing a blanket do not resuscitate, do not intubate order. We speak with patients and their families about their preferences. You know, do they want us to attempt a resuscitation? We certainly have patients and families who say, yeah, don't do that. And when we hear that, we respect and honor that request, but there's no blanket order to not resuscitate people at all.
Unfortunately, we could get to that point. So when you think of crisis standards of care, it's a spectrum. We're at the very beginning of crisis standards of care, and we've heard about how dramatic that situation is. Unfortunately, it can get a lot worse. I heard someone say yesterday, well, it can't get much worse. Unfortunately, it can, and we could get to a point where we get to mechanical ventilation situations where there's not enough resources to go around, and they would be forced to say, we are not going to resuscitate people because we are under the most extreme of the extreme circumstances. And I want to double underline that. We are nowhere close to that right now.
Right.
It's part of the overall plan. You plan for everything.
It's just like in any emergency plan. You write down every scenario possible and you figure out how you handle it. And that's what this is.
So the information surfacing saying that there's DNR information in the state documents, that is true. It's in there, but we are not at that point. And I think it's really important that we clarify the difference between what's written in a plan and what is the plan of action.
Right, as you said, there's no blanket statement. Every system, every hospital is handling it differently. Not everyone's in the same situation. All right, thanks, Joe. We've heard from and spoken to Dr. Souza several times during this pandemic, and at this point, as he made clear to Joe, he's not sure there's anything more that he can say. When they had his conversation with him today, he felt like he'd laid it out on the table, not just yesterday, but in all the times we've spoken with him before. He's already said most of this stuff, repeatedly. What he said months ago, he reiterated yesterday. He even concluded this caveat yesterday, I know we sound like broken records when referring to what he was about to say. Now, despite that disclaimer, there was one thing Dr. Souza said yesterday that caught our attention that we didn't have time to include. He said after 18 months, they, meaning the local community members, medical community that is, they have gotten pretty good at predictions with this pandemic. He said, given the current rate of transmission, we can expect 9,000 Idahoans to get the coronavirus within the next week. Then he went on to say, with about 50% of those eligible being vaccinated, let's assume that means there's an equal chance of both vaccinated and unvaccinated coming into contact with the virus. Equal chance is being generous here because, as he said, we tend to see different behaviors from those who are vaccinated. But the Delta variant has also eroded the efficacy of the vaccine in terms of chance of infection. But for argument's sake, let's go with equal chance. Here's where it moves away from being equal. Dr. Souza reminded us yesterday, 90% of the COVID patients they are seeing at St. Luke's are unvaccinated. 98% of the COVID ICU patients unvaccinated. Now, given those statistics, he broke down the vaccinated versus unvaccinated like this.
You guys, even if the numbers stay flat on the rate of rise that we're seeing in the state, 9,000 of our fellow Idahoans are going to acquire the infection this week. Out of those 9,000 people, with those generous assumptions, we might actually expect that 3,000 of them are vaccinated. We would predict out of those 3,000 people that 15 of them will need one of our hospital beds, and 3 of them would need an ICU bed. And sadly, 1 of them might die. In the 6,000 unvaccinated patients, we can expect 300 of those people to need our help in a hospital. And we can expect 60 of them to need our help in an intensive care unit. And sadly, we can expect 24 of them to die. And they are not a statistic. Those are 24 human beings. Now, I don't know their names today, but some of us around the state will come to know those 24 people's names in the 9,000 that are going to acquire it this week. And we'll hold their hands and we'll care for them and we'll know their families. and they're not a statistic.
And you can see the effect of that on his face. How losing a patient, even those that could have avoided death by getting a vaccine, well, just tears into a healthcare worker. It's that emotional toll that has probably been the most difficult for our healthcare heroes. And yes, there was a time that we thought of them as that, as heroes. That warm and fuzzy feeling has seemed to have worn off lately all across the state of Idaho, which is why Dr. Kenneth Krell, an ICU doctor at Eastern Idaho Regional Medical Center in Idaho Falls, did what he did last weekend. Dr. Krell, who is 71 years old and currently working a 36 on 12-hour off shift, was called into work last weekend because, well, they were so busy. It was in the middle of his time off. And driving in that morning, he said, he thought of something he wanted to tell his coworkers. So he wrote it on the whiteboard when he got there. In the end, what sustains us and what we will remember about having survived this madness are the remarkable people who endured this with us. The best of humanity, all of us, who demonstrated the best of our calling. We endured this together and supported each other. We saved lives and lost lives, and we did both with compassion and competence. We will never forget this.
That's the way I feel. And I never intended for this to be spread to anybody outside our immediate staff, of course. But I think it did resonate with other healthcare workers. And I'm pleased that maybe that gave a little boost to all of us who are under the worst circumstances we could have ever imagined.
Have you had some of them that have struggled with that, like wondering this, like Sisyphus, like this uphill battle that never seems to end?
We all struggle with that. You can't be human in healthcare at the moment and not struggle with wondering what you're about, why you're doing this, what good you're doing, given what circumstances we're under and what we're seeing in the community, which feels very much like complete lack of support. That we've gone from a period last winter where people were praising healthcare workers to more often now, it often feels like we're admitting patients with COVID who yell at us that they can't possibly have COVID because it doesn't exist. And patients getting angry if we ask them whether they were vaccinated. To patients saying, I can't possibly have COVID, I took ivermectin. So we do have to remind ourselves what we're about, why we're here, and why we're in this war.
Eastern Idaho Regional Medical Center has 29 ICU beds. Dr. Krell told us today they are always full these days. In fact, there have been days where they've had to put patients in the infusion center, in recovery rooms. Some have even stayed overnight in the emergency room until a bed opened up in their ICU. As you heard, that message was meant for his colleagues. But one of them posted a picture of it on social media, and it was seen and reposted by an Idaho Statesman reporter yesterday. And since then, that picture of that message has been seen more than 1.1 million times. And hopefully, by those in the healthcare profession who could really use a message of the best of humanity doing what they could be capable of doing right now, who could really use that message of hope right now.
I think if we're going to approve their hiring, it ought to be subject to them presenting proof of vaccination.
Guess which school district in Idaho will become the first to require teachers to be vaccinated? Well, the state's current vax rates should tell you that. About the only requirement to be part of the 208 conversation, though, a cell phone. Send us your questions, your comments, and your complaints to the number on your screen, 208-321-5614. Don't forget your name and the hashtag, the 208. We're going to share as many as we can at the end of the show.
Tonight, the Pentagon admitting it hit the wrong
If we've got a healthy adult who is taking a job with the district and they're going to be paid with taxpayer dollars, then I can't see any reason why we would hire them without proof of vaccination.
Well, 4 weeks into the school year, Blaine County School District says they haven't had to shut down any classrooms or any schools because of a COVID outbreak. And as you just heard, School Board Chairman Keith Rourke say they're going to keep it that way, or at least they intend to. The district, which currently does have a mask mandate, says they sent out a survey to all district employees about their vaccination status. And they've received 373 of those back, which is about 70% of the employees. And of those 70%, nearly 95% say they are fully vaccinated. Blaine County, by the way, the highest vaccinated county in the entire state of Idaho. Not even close. 84% of the population there fully vaccinated. More than 90% of it had at least one shot. So during Tuesday night's board meeting, the board discussed requiring all new hires to be vaccinated before they can begin working.
I kind of feel like this is the time to draw the line in the sand if that's what we choose to do. I feel it's tough to look at parents and say you're maxing your child. None of us want to be doing that, yet we're letting people in the classrooms that are not vaccinated.
I just can't imagine why we would hire people who are not vaccinated now simply to add to the ranks of those who aren't vaccinated. It doesn't make any sense to me. If somebody wants to be hired and they say, I want to be hired, but I'm not going to be vaccinated, I think that question just answers itself. Go find another job.
And the board agreed, majority of them, 4-1. The only nay vote came from trustee Amber Lorna there. She told the board that it should be a personal choice. It's only going to apply to new hires, again, within the district. Those who are already employed but are not vaccinated will still be employed by the district, so nobody's really getting fired. But it is happening. So some part of Idaho is taking the extra step to keep COVID in check. Just not enough of the Gem State is doing the same, according to several of the people who text in and email this show. And at least one other person who lives across the border in Washington. And he's kind of an important person. Governor Jay Inslee this morning went on TV and aired his frustrations with the state of Idaho, where there are no statewide mask mandates or vaccine requirements, contrary to what's happening in Washington. But he said what's not happening in Idaho is having a tremendous effect on what's not happening in Washington.
There's way too much me and not enough we when we talk about COVID. People who are not vaccinated, people who are not masked in the appropriate circumstance, are a clear and present danger to everyone. And when the Idaho politicians refuse to act with common sense measures, it not only endangers Idaho citizens, it endangers Washington citizens. And today in my state, Washington citizens in many cases cannot get heart surgery, cannot get cancer surgery that they need because we're having to take too many people of unvaccinated nature and unmasked, many of whom will come from Idaho. And that's just maddening, frankly. So we are calling for Idaho and the leaders there to lead and take some common sense measures. I'm disappointed the governor of Idaho has spent more time trying to reduce protection by reducing vaccine usage instead of concentrating on this and then clogging up my hospitals where I can't get cancer treatment. So yes, we're extremely disappointed.
Well, Governor Inslee went on to say the crisis standards of care the Panhandle has been under, and now the entire state is under, has sent Idahoans across the border to seek medical care. We did reach out to Governor Little's office to ask him about this, but we haven't received an answer yet. Governor Little did manage to let us know about a letter he sent to President Biden today regarding vaccine mandates in Idaho. Along with Speaker of the House Scott Bedke, President Pro Tem Chuck Winder, Attorney General Lawrence Wasden, and all of Idaho's congressional delegation, the letter challenges Biden's directive that all companies with more than 100 employees require the COVID vaccine or weekly testing. In that letter, Little says only the states have the power to enact such mandates, not the federal government. And if Biden chooses to move forward, the letter states, well, Idaho's going to have no choice but to take legal action. And in case you are curious, Idaho has just hit, not just, but this week, just hit 50% vaccination of those eligible. Washington State up to nearly 70%. All right, we got a heads up for those of you planning to attend the Boise State game tomorrow on the Blue. They put out a release today, the university did, announcing students will have to show proof of vaccination or at least the first dose or provide a recent negative COVID test to get into the game, saying, yeah, that's going to happen for tomorrow. And for the October 2nd game, the home game there, that's going to apply to all fans in attendance, not just students. But for tomorrow, it applies to students. We have more details on this on our website, releasing this late this afternoon, getting that word out there before tomorrow's game against Oklahoma State. All right, to your comments from today. Blaine County is the highest vaccination rate because they got hammered in the beginning and know that COVID is real. I hope the rest of the state doesn't need such a wake-up call, but I fear we do. Holmes with a Z. Thanks, Kyle, for sending that in. That's a good point. They did get hammered early in this, and they kind of know how it is to be in this, well, crisis mode, or at least close to it. So many vaccinated people out here very angry right now, Virginia says. Yep, there are a lot of them. We hear from them. As healthcare workers, we're tired and exhausted. Vaccines and masks work. Let's all put our political views aside and get this crisis under control. Here's to all of our healthcare providers and especially my fellow respiratory therapists, says Randy. We couldn't agree more, Randy. A lot of love needs to be shown to our healthcare workers out there right now because they're certainly not feeling it, even from the patients that they are trying to help right now. Have a good weekend.